Dr. Esther Kim, it is so good to see you. Good to talk to you. How are you?
I'm good. How's it going?
It's good. Yeah. I'm in Memphis. Tell us where you are.
So I'm currently in Clarkston, Georgia. We are just a suburb outside of downtown Atlanta, about 4 miles from downtown Atlanta. And we currently serve here at Ethne Health.
Yeah. Clarkston is sort of famous for its diversity. Tell us about that.
Yeah, so since the 1980s, the state of Georgia has resettled majority of the refugees that we receive as a state in Clarkston, Georgia. And because of that, we're called the Ellis Island of the South, with over 100 people groups represented and 60 languages spoken in just a 1.5 square miles. It's pretty diverse. So if you walk down our downtown, you can have sights and smell and sounds that are just from all over the world. At Ethne last year, we saw patients that spoke over 40 languages. And so it's pretty amazing, but also very complicated, as you can imagine, with different cultures at play, different languages at play as well.
Yeah. Tell us, how long has Ethne been in Clarkston?
So we opened our doors October 24th, 2018. And so we will be coming up on our 7th year this year. And just through a lot of support prayers from our CCHF community, we opened our doors. And the first day we opened, we had 2 paid staff. We saw 2 patients in the half day. And as of last month, we have over 45 paid staff. And on average, we see about 1,200 patients a month. So incredibly blessed to be able to be here. Again, just a lot of support from the CCHF community. And we're so thankful we get to serve here.
When I visited, I can't remember how long ago it was, you all were in a small, kind of a converted house, the downstairs part. And my recollection is there were maybe 3 exam rooms, something like that. And you've had since moved into 2 different clinics since that time, I think.
Mm-hmm. Yeah. So after you visited us, I think in 2019, you challenged us to, I think the word you said, you want people to take us seriously. And so what we were doing was, we were providing healthcare, but you were right. Like, we were just in this little house with 3 exam rooms. And what we wanted to be the medical home of Clarkston. And so for us to take care of more patients, for us to really professionalize what we're doing, we did take that advice, and we moved to our second location, which was a 7 exam room office, just half a mile from where we were initially. God was so providential in that timing of it. We moved in that building February of 2020. In March of 2020, COVID happened. And because we were in a larger space, we had a larger parking lot, we were able to see patients, we were able to provide testing and eventually provide vaccine. And I don't think we could have done that in our smaller space. And so the timing of it and just even the encouragement of timeliness of that was really, looking back now, was from the Lord. And because of our presence, because of our consistency in providing those care during COVID, people trusted us. Our community saw us as that medical home that they were looking for. And so we continue to grow. And now we relocated to our 3rd location, which is in between our first and second location. And we went from 7 rooms to 15 rooms. We can accommodate up to 4 to 5 doctors per half day and see patients. And so I think, just as we were growing slowly, we also knew what we could handle at the time. We only were seeing patients 3 half days to start, and then 4 half days, and then 4 full days. And now we're seeing patients 40 hours a week. And I think it's just a journey. But in looking back, really just appreciating people speaking truth in our lives. I think even the core value of CCHF, a prophetic voice, right? Hey, seeing things and calling that out, and then courageous faith to take those steps has been some of the things that we've seen Ethne grow, and the beliefs and the core value that we live by.
Yeah. Well, I remember some of those days, especially the early days of the COVID crisis. And I remember that Ethne was uniquely, God had put them in a unique place because you could connect the messaging that had to happen with so many different culture groups, and you'd establish trust. And I saw it then, and I think everybody sees it now. Like, the courage that you all had in stepping out and taking leadership for that community during the COVID crisis when nobody really knew what to do, being obedient. It locked you in with the community at a lot of different levels. And so, yeah, when the crisis came, you guys stepped up and you were there for your neighbors. It's really beautiful.
Yeah.
Hey, this is sort of an odd question, but every year there are hundreds of people who are at the CCHF conference for the first time attenders. And so I wondered if you remembered the first time you went to a CCHF conference.
So the first time I went was the 2013 conference. It was in Atlanta at the time. And I think I was invited from our residency because I had matched into residency, and the residency was people from the residency were going to be there. And so I was like, oh yeah, let's go. And so I remember going into this conference, and I had been to other Christian healthcare conference before. But I just felt like this is my people. Like I felt that just even in conversations that I had with people, they really care about this work. And I just was, for the first time, I was like, these are my people. And I don't know why. I wasn't a part of a CCHF clinic. I had only rotated through CCHF clinics for 1 month. And but I think just the intentionality of everyone that I had met at the time, they really took time to ask me questions and just very quickly share about their journey and their struggle. I remember walking away like, this is my people. I don't know why. I didn't even know I was going to serve in a CCHF capacity or work in a clinic long term. I didn't think I was going to work in a clinic, period. But yeah. I think leaving that conference, I was like, just with the worship, there was something different. And it wasn't just, they were focused on students, but also people who have gone before you. They were willing to share their journey with you. I don't know. I just felt like it was very intentional. And I can say that confidently that in the last, I guess this will be my 12th conference. I get that every year. It feels like a family reunion of all the troops coming in and sharing war stories. What bruise did you get? And how can we attack next year? But also how can we mend together? How do we heal? It really does just feel like that yearly reunion. You bring your friends to your family, and there's some craziness happening, but in the months of that story sharing, and you feel like you're not alone in this. And so, but yeah, I think I can still say that that first conference is how I walked away that day, feels consistent every year since then.
And you were a fourth-year medical student that first conference. Yeah. So you were a young overachiever. So you were probably 24, 25 years old at that point, I guess, huh?
We'll see. I don't know. Yeah.
Hey, you mentioned about Clarkston is the Ellis Island of Georgia, or it's an entry point for a super diverse group of people from a lot of places. You've probably learned a few things about cross-cultural medical care.
Yeah, just a few. I've made a lot of mistakes. Yeah. Well, if you want me to share a few of them, I'm happy to.
Yeah, I would.
So I would say, one of the beauty about being here is not one culture is predominant, right? And so we're kind of in this posture of, I don't know what I don't know, please show me. And I think one of the biggest assets we have here at Ethne is many of our staff are from the communities that we serve. So as I mentioned, there are over 100 people groups represented here in Clarkston. We have some of the majority the groups in Clarkston that have higher number in population, they're also represented on staff. So we have someone who speaks Arabic. We have 10 languages on staff.
Did you say 10?
10. Mm-hmm.
10 languages on staff. Wow.
On staff, in person. We're going to be 12 starting next week. And so.
Which languages are you adding?
Rohingya, Swahili. Rohingya we just added this week. Next week, hopefully we'll add Swahili and Kinyarwanda, which are some of the languages spoken.
Central African, yeah.
Mm-hmm. But our predominant language is Dari, Pashto from Afghanistan, Arabic from Sudan and Middle East, Karen, which is a Burmese people group,
Thailand. Yeah, sorry.
and
Yeah.
then Burmese and Thailand. A lot of them are in the refugee camps. And we have Amharic, which is from people from Ethiopia, Spanish, people from South America, as well as we have some French speakers, English speakers, and then some of them, Mandarin and Korean that we have here, people that comes once in a while. And so one of the greatest asset, I think, is just not just interpretation, but the cultural navigation of our patients. And so our staff will help us understand, like, this is how my people group live.
Yeah.
And like when you tell a Burmese patient not to eat rice, you tell them to like starve, right? And so trying to find ways of just being more culturally sensitive. I think during COVID, we found that there was a lot of stigma with people testing. They don't want them to know they have COVID. They would rather die than know they have COVID because of the shame. And so how do we test people, and how do we encourage testing and vaccination? Similarly, that fear was there. I've had to learn the hard way where some of the men may not view me as a doctor, right? And so building that trust, taking care of his wife well, taking care of his children well, and starting to build that trust that, hey, like, you are adjusting to American lifestyle. You're adjusting to viewing a female as a physician. I'm adjusting to working with that. And there's just a lot of humility in saying, hey, I just want to care for you. And let's learn, let's do it together. Like, really, the end goal is the wellness of your family, all pride aside. We've also made a mistake where a lot of our patients are coming from war-torn countries. They've experienced a lot of trauma, or even just the way we provide, like when we do vital signs. So, for example, we'll use like a thermometer that looks like a gun, right? We've had patients that just said, put that gun down. What are you doing? And you're like, what gun? This is just a thermometer, but it looks like this, and you're aiming at them. And for us, we're doing that 50 times a day, right? It doesn't really mean much to us. But for someone who has been through checkpoints in their countries, eventually leading them here, that action can bring up a lot of kind of what they've experienced. And we're just learning from these mistakes. We let our patients know that that is not our intention. We try to scan their arm first, let them feel what it is, or we'll use a different kind of thermometer. And even just making accommodations, right? We have patients who only want female providers, or only want females to see their wives, and so we have to respect that, and we can schedule, and we hire more female providers because we knew that was a need. Really just shaping our operations around how can we make it a culturally sensitive place for them to experience love of Jesus here, because outside of just everywhere they go, a lot of times they don't feel welcome. Actually, they feel rejected. So
yeah. I'm sure you've gotten this question a great deal lately. Like, do you think your folks, most of whom are here, I think, well, I don't know. My presumption is that most of them are on pathways to citizenship and have come through the State Department. But is there a heightened concern about changes in the administration and how America deals with immigrants and refugees?
Wow. Yes. Yeah. I think just practically speaking, a lot of our patients have lost just support from resettlement agencies. They were promised kind of caseworkers up to a certain point of their journey, and now they have nothing. The agencies are still open. They can still go and seek counsel, but the one-on-one case management that was supposed to help them, guide them through the first 9 months of their journey, those caseworkers are no longer available. So I think that has been the hardest. And secondly, I think they're on their pathway to citizenship, but many of them are not sure if that will be honored.
Yeah.
And so I think the unknown is what's fearing people. I think the other thing is just a lot of rhetoric. Just, like I had a patient that asked me to start bringing my passport around. And I was like, me? You think me? And he's like, I think you should just be careful, doctor. I was like, okay. And I
Wow.
think people want to help each other.
Yeah.
And at the end of the day, they're just caring for their family. And I felt I was shocked that he offered that advice, but then I also was thankful that he was caring for me as a part of his community.
Yeah.
And I think in the midst of fear, people um, are. I've seen a lot more patients coming in with insomnia,
Mhm.
headaches, back pain that I think manifesting the stress that they're carrying. And so, whether I think our hope is in Jesus, and that's why we're continuing opening our doors. We're serving. We're hoping to provide some sort of case management where we don't have case manager, but we know at least where to go. We can have
Fill in
volunteers,
some of the gaps there.
yeah,
Yeah.
who speaks English, who can take them there, have volunteers, and so we're still here. We're still here. We know we've heard needs, and we're trying to address those needs, even though some of the fundings may get cut off.
Yeah, and there are sister ministries across the country who are struggling, in some of these folks have high percentages of people who are quote unquote illegal or undocumented, and so yeah, it's definitely difficult time and difficult era, but I think the courage and the core values of most of the people in our community are going to guide them, whether
Mhm.
President Biden's in place or President Trump's in place, and the center of who we are and what we're doing isn't really tied to either side of the political spectrum. A couple other questions for you. You and your partners, who I know and love, the work that you've done has been kind of in a crucial time in life, and you're a leader, and you're a doctor, and you're a mom of two now,
Mhm.
and you did all of those things kind of at the same time and at a crucial time in life, or at least a high pressure time of life. And how's that going?
Great. Yeah, no, it is a lot at times. If you listed it all out like that, it does sound like a lot. Um, so I have two boys, ages 7 and 4, very active. And my husband, Andrew, is a doctor who also co founded a clinic with me, along with two other friends from Memphis and two other friends from Atlanta. And so that was our founding team. Um, and to be honest, I think during residency, I was hoping we would go overseas, right? We would take the gospel to the unreached people group, and or if we stay in the US, like just work in a clinic, work in a hospital and get a W-2 and like serve and live in the community. um, but that was not God's plan for our lives. And I think a few things I would mention: just don't do it alone. I think
Mm,
um, do it in community is so important. I don't think we could have started Ethne just with my husband and I. Like it really took a team effort. Like the giftings that came together, the Lord knew. And when we didn't have one gift and we pray for it, someone else had that gift. And the Lord really does work in community, like in bodies. And so the eye cannot tell the arm, I don't need you. Like we really do need each other. And so I think Ethne is a story of just God's body working together and his gifting manifesting in its beauty. It's tricky, right? Because you work
yeah.
with people you love, you work with your friends, and how do you keep each other accountable? That has been hard. I think just even them keeping me accountable, like how do you keep me accountable and how do we keep each other accountable? That has been something we're learning, because the ultimate goal is the Lord will be glorified through Ethne, right? Not our pride or our personal agenda. And so if by keeping me accountable, I can be a better leader and the better doctor for Ethne, please keep me accountable. And if you're not doing it, we're hurting as a clinic. And so that's been something we're learning a lot. I think to balance life and work, it takes a lot of planning and just prayers. Their childcare, like you have to think about childcare, you have to think about what people are eating, and um, like where are they going to school, and those are a lot of decisions that you have to make. And I think again in community, we have mentors that we've called upon. Um, I don't do it very well. Like we eat out once a week and we eat at Chick-fil-A once a week. There are things that we just have in our rhythms to help us. And then how do you even incorporate Sabbath rest? That's one thing that we've been really working on the last few years so that our kids know that we're not just working at Ethne and that's it. Like we want
Yeah.
them to know ultimately we're just depending on the Lord. Like Sabbath rest is needed for our family to thrive. And so putting that as a priority and to still have fun. Like you have to have fun in what you do. Andrew gave a talk on happiness last year. Like we've
Yeah.
been really just learning like how do you be happy in what we do in a very hard setting sometimes when people are not feeling better. Um, Tensions arise within our community. How do you still remain happy and joyful? And I think a lot of that is returning to the Lord and like depending on his community. um, to someone who is about to graduate residency or in similar age range and having all these responsibilities of their lives, it's possible. Like, I think I don't want you to think I can only give time to the Lord after my kids are grown, after I've paid off my loans. Like, you can do all that. Like, the Lord will provide. You don't have to shy away from that just because you're young or you have loans and you want to have kids, and have your kids do it with you. Like, the Lord is in it, and we've seen that. Um, and it's been a joy. Like, they come to Ethne and people know who they are, and my kids sometimes, just walk in an exam room and just be like, oh,
Yeah.
um, when there's no patients in there. I think just involving your family, like we don't have to separate life, work, ministry. I'm not saying it's easy, it's
Yeah.
messy at times, but
Yeah.
it's worth it. And the Lord does provide in ways I can't even imagine.
Yeah, over the years, I've seen there's sort of this paradox where you think like, oh, it might get more complicated if we're churching and working and living with the same people all the time. And there are some issues with that, but it's also a lot richer and unifying. And yeah, and I love bringing our children, our families into the work with us and into the larger community with us is always beautiful too. Yeah,
Yeah, they get to come to like home visits with us. They get to try foods from all over the world.
yeah,
They know what Ramadan is because right now is Ramadan, and they understand like why some of our neighbors are not eating during the day, and then we get to pray with them. They understand, they know all these different languages, like basic greetings, like just really fun things to involve your kids
yeah.
in. Um, and that is going to hopefully sow a seed in their heart, right? To be able to carry that to the next generation because they're going to live way past me and they're going to have that same DNA, that passion to bring it to the next generation.
Yeah. We are so excited that you're going to be one of our main stage plenary speakers. In fact, you're the closing speaker on Saturday morning on, I guess
Yay!
that'll be yes, April 12th, coming up soon. Um, Having done that before myself, I don't always have every thought in place 5 or 6 weeks before the conference, but I wonder, have you got some thoughts about what you might be talking to us about that Saturday morning?
Yeah, so I'm going to be talking a lot about just God's greater story for us as a CCHF family. I think, um, what do you have in common with a doctor from Louisiana, a doctor from Malaysia, and staff from Sudan and Burma? What is the common thread? I want
Yeah,
us to kind of just see that greater picture of what God is doing here in our country, but more than just in this time. I think in this time that God has given us, in this moment, in space and time, what is God calling us? I think I'm really excited to kind of share some of the things I'm learning and that God has been impressing on my heart. And more than that, I also want us to celebrate what God has done through CCHF. I think part of the heart behind what I'm going to share is God's story for us. God's story for us in this time, but also how has CCHF been a part of the story. But yeah, I'm really excited. I'm going to share about a parable from Matthew. You can take a guess which one it is, and kind of leading us from that in how to follow Jesus. So I'm excited.
All right. Dr. Esther Kim, one of my heroes, and in many ways, I think a super important, maybe even backbone part of the early years of Ethne. I think, lots of doctors and other people involved, but it struck me that you were the most consistent person involved for some time. And so there's always different seasons and different times, but you were faithful at that time. And we're just so thrilled to see what's happened in Clarkston over the years. And we're all excited to hear from you at the conference coming up. So thanks for taking time to talk with me today.
Yeah, you're welcome. Looking forward to seeing everyone.